Great. So welcome on to our webinar. I hope you thoroughly enjoy it. My name is Victoria Shields, and thank you for the introduction, Kasia, as well. So my background, obviously, I have 20 years experience in the beauty industry. So in the UK and the Irish market, typically our skin trajectory is we start in the beauty therapy industry. And I suppose in the last number of years, there's been an option to be, if you like, a skin therapist or skin specialist now that the industry has moved on. So about 11 years ago, I moved from beauty therapy into more skincare specialisation. So I've worked with predominantly mostly skincare in the last 11 years. HND is Higher National Diploma Level 5. So again, in the UK and Ireland, we have different grades of therapists. So we have anything that starts at level 1 and goes up to level 5. So it's a Higher National Diploma, and that is in beauty therapy and related sciences that my qualification is in. Corneotherapist is a new name, a new title that some people mightn't have heard of, but corneotherapy is really methodology in how we treat the skin. So corneotherapist is somebody who respects the epidermal skin barrier. Our goal is to enhance skin health without compromising the barrier at all times. So it's a very fancy name, corneo meaning corneocyte and a therapist. So basically, if you want, I'm a therapist of the corneocyte, and we really want to respect that and do all that we can to enhance the cell health, which microneedling really does. I also have my own independent skin clinic. I opened that back in 2017, long before the skincare industry became popular. So I really seen a market for improving skin health, and I opened my own clinic. Predominantly, we only treat skin in our clinic back in 2017. And most of all, I'm passionate about advancing skin health. So our presentation is all things microneedling. I often say this, but we've got to think beyond the needle. This small, humble device that we call microneedling, I often wonder, does it get the credit it really deserves? You know, I always say in our industry, we're all bombarded. It doesn't matter what part of the skincare industry that you come from. We're bombarded with a lot of things and devices, and the amount of stuff is incredible, but sometimes we forget about this little device we call microneedling. It's a small device, it's a humble device, but it's something I hope you will see through my presentation that I'm very passionate about. And I really want to give it the credit it deserves through this presentation and really encourage you to think beyond the needle this evening. So I want you to think beyond the needle. I want you to be able to understand microneedling in a way that you can needle to success. It's something that I have done in my business for the last 7 years, and microneedling is really a big part of that. And I want to equip you with that information this evening. So through the presentation, we want to explore the opportunities and benefits that you can have with microneedling in your practice or clinic. I also want to encourage you to think big with microneedling. Small device, but I want you to think of the amazing benefits and the big results that you can get for your business and for your clients with microneedling. I hope to share some practical insights into my years from microneedling and how I carry out microneedling within my business. And I want to empower you to achieve optimal client outcomes, because that is what we want for everybody. We want the best clinical outcomes for our clients. And I also want you to see the benefits of microneedling for you in your practices and your businesses, because it has incredible benefits for all that I've just mentioned above. So before we think of microneedling, as I have said at the start, I am very passionate about healthy skin. At the end of the day, anybody who lays their hands on skin, whether you're a therapist, practitioner, skin therapist, doctor, medic, whatever that is, if you are putting your hands to skin, then surely the goal of that is to improve the skin health. That's what we do as therapists, as skin therapists. We're there to improve the health of the skin. But really, to do that, we need to think about, what does healthy skin look like? So if that's the optimum outcome we're looking, well, then what does that look like? What is a healthy skin that we see in front of us? So just a few key markers. A healthy skin is definitely soft and supple with a very robust skin barrier. So that means it's not reactive. It's not, causing a lot of inflammation. It's not throwing the toys out of the pram as it was. It's very regulated. It has really good hydration in both levels, both the epidermis and the dermis. It's going to have good elasticity and bounce back. So it's going to have good turgor to it. And we are going to have a normal desquamation. And normal desquamation is something our skin does. And healthier skin, it's going to do that optimally well itself, which means it shouldn't have a lot of roughness or texture. And certainly congestion and buildup will be kept to a minimum. It also will have a dermis, which is rich in collagen and elastin, all the things that we're looking for. It will also have a balanced oil production, so it's not going to have significant amount of oil and it's not going to have a significant lack of oil. And a good healthy skin generally has an even skin tone with balanced melanin production. So again, that's the ideal epitome of a healthy skin. And the reality is that when skin is healthy, it looks its best, and so do you. And that's what we want for our clients. We want skin to be healthy and looking its best. So we think of healthy skin, and now we've got to think of, well, what is microneedling doing in that picture of healthy skin? So microneedling has a lot of different terminologies throughout the world. So it's also known as collagen induction therapy, which is CIT. Obviously microneedling, there's a lot of different terminologies, but really the procedure itself is a cosmetic procedure that involves using a device with fine tiny needles that create punctures in the skin. It sounds simple, doesn't it? But what are we trying to do when we do use these devices to create holes and punctures within the skin? Well, these micro injuries then stimulate our body's own mechanisms to produce wound healing, which is the release of growth factors, increased collagen and elastin production. And I want you to keep those letters or those words in bold in your mind's eye as we go through the presentation. So we're triggering a response which releases growth factors, which will then increase collagen and elastin production, along with many other things. So what are the skin benefits of microneedling? We've talked about the release of growth factors and that it triggers collagen and elastin. But again, what are the skin benefits that we think about when we think of microneedling? You know, all of us have a list and some of us specialize in different areas, but there's a massive amount of skins that can be treated with microneedling. We all look for the collagen and the elastin and anti-aging, but we have a huge plethora of skin conditions that can be improved with microneedling. So if we have aging concerns, we're going to improve the collagen production, which is going to obviously then have a reduction in our lines and wrinkles. Scarring, different types of scarring or acne scarring, it's obviously going to remodel that tissue to improve the scar tissue. If we have clients with enlarged pores, again, multiple reasons could be for that, but it definitely improves the structure and integrity of the collagen and elastin, which will also tighten and help to refine the pore structure. If we have clients with redness and rosacea, this is something that isn't necessarily talked about, but new studies and research, and certainly from a clinical point of view and what I've experienced, is that we can really help support those who suffer with rosacea. And it just happens that April is Rosacea Awareness Month and Stress Awareness Month, all of which are interconnected into that pathway to rosacea. So it really helps to manage the capillary network within the rosacea problem that we see on the skin. Again, as we age, we have a thinning skin. And the good thing about doing microneedling is that the epidermis is preserved and actually proven to thicken over time. So we're never compromising the epidermis, something that we want to be as optimally protected as, especially as we age throughout our lifetime. If you have a client who simply has dull lackluster skin, we want to improve the skin quality, which will improve the skin function, which will then improve the clarity and the brightness of that skin. And the lovely benefit of microneedling is it's a natural result. We're using our body's own healing mechanisms for this all to happen. So it's not anything that, if you like, is synthetic. It's actually triggering our own body to do the work for us, which is pretty incredible in all the things that we do within our industry. So we've got the skin benefits, and most of you sitting on this call most likely may have a business in microneedling, and you're thinking, what are the business benefits of microneedling? And again, I am here to present, but I have a business and I'm a therapist as well. So again, in our industries, like I alluded to, we have a lot of different options of devices and technologies, but microneedling, I think you'll guess this by now, but is definitely one of my favorite treatments. The benefit of microneedling into your business, it's a low investment. When you think of the cost of a lot of the technologies that's out in the market, a significant investment is required for a lot of them. In the scheme of things, microneedling is quite a low investment. It is also a low operating cost. I'm sure in many of your countries it's the same. We have a lot of licenses for lasers and advanced technologies that we have to work with, whereas with microneedling we have very little operating costs and servicing costs and things going forward. We have an immediate impact on our revenue potential and also repeat clientele. We get the revenue by bringing in the business, and we get happy clients who want to come back and have a course of microneedling treatments. Again, being able to treat a wide range of skin conditions, there is not many technologies on our market that are so amazing yet so generic that can treat a wide range of skin conditions, and also safe on most, should I say, all skin tones if done correctly. So we don't have many limitations when it comes to microneedling compared to lasers and other advanced devices. So huge business benefits in such a small device. So again, I really want to give you some of my personal experience in terms of why I chose Exceed in my business. I speak with integrity when I speak to people. I speak with authenticity. I don't want to give people any false information, but you know, as a skin therapist and somebody who's very passionate about skin, it really does matter what devices and what we do to bring into our business to get those results. It's something I've been very strategic about throughout my whole business journey, but definitely, I've used other devices in the past, and I've used Exceed for the last number of years, and I truly hope you can see how passionate I am about it. Exceed isn't just a device, it's a precisionally engineered device of microneedling. It is significant quality. Thankfully, I've never had an issue with any of my devices in my clinic, and the quality of the needles are superior compared to anything I've ever used before. The microneedling device goes also up to a speed of 150 times per second, which is incredible in terms of the results we're able to get on the skin, and with the speed of oscillations that we're able to get into our client's skin, and to be able to adapt that to the types of skins and the clients that we have. Something again, which is not very common. I know globally there's people going to be listening to this webinar who will argue for both numbing the skin and for not numbing the skin, and I'm not going to get into the depths of that. But with the very fast speed of the microneedling device, we have something that kicks into place called the gate theory. And the gate theory is that the body can either pick up one sensation at a time or another. So for example, with the fast oscillation of the device, we get a lot of vibration, and the vibration negate a lot of the pain sensors from skin. So we don't numb at all in our clinic when we're doing microneedling treatments. I know for some people that may be a necessity depending on what you're treating, but it is such a comfortable treatment to have done. And again, you can ask me more about that if you want to, but just for confidence, and especially for skin therapists who are maybe not clinically allowed to apply numbing, it doesn't mean that this treatment can't happen. We do it very effectively without it. Again, the needle itself is a tilted needle plate, which is really important because it means that as we're coming around the curves and contours of the skin, that plate is automatically tilting, which means less trauma and tugging and pulling to the epidermis. So definitely minimal epidermal trauma throughout the treatment, very quick recovery times, and again, very comfortable to have the treatment. I love the small cartridge head. It means we're able to work close around the eye tissue, around the nose, close to the lip area, with very much precision as well. And definitely, I believe we can achieve an endpoint much faster with a less traumatic experience for our clients. And to be honest, in 2025, our clients want results with as little downtime as possible. And certainly as a skin therapist, I want to create that with as little trauma as possible to that skin. And also just practically using the device. It's a very quiet device, and it is a pleasure to work with. It's a really comfortable device to work with. So now I'm just going to give you some of my background and how I succeeded in business with microneedling. So I always say the microneedling is part of the tools in our box, if you like. It's something that we have to give us a treatment outcome. But two things I really believe that's so important when it comes to microneedling is our education of our skin and the preparation of skin. So before any of us ever lift a needle to somebody's face and create that pathway that we're trying to create, we really need to understand skin first. It has to be about understanding skin, its cells, its systems, and its communication pathways. You know, I I'm in awe of skin and the organ that it is and all that it can do for us. And when we understand it really well, it means that when we go to do treatments like microneedling, then we can make sure that we're making the right parameters and measurements and treatment outcomes for our clients. We really need to understand what microneedling does. We need to know that when we needle skin, we are activating stem cells for skin renewal. But the reality is that if we don't have healthy stem cells, then we're not going to get good outcomes at the other end of it, or certainly we're going to have reduced outcomes at the other end of it. And with that in mind, we need then, therefore, to prepare the skin for a microneedling treatment. So I certainly believe in my clinic that preparation is adequate to give us all those amazing results that we can read about and hear about and see photographs of, because a healthy skin, a healthy stem cell will produce better results after a microneedling treatment. Personally, I like to have an absolute minimum of 4 weeks on a proper home care program for my clients, with other advice in terms of lifestyle before I microneedle my clients. An analogy here that I often use is don't go heavy too quickly. If you go to the gym tonight and you go into the weights room, you're not going to lift the heaviest thing. First of all, you're going to prepare to do that. And I allude microneedling when I'm training is to a bit like weights. It's an advanced skin treatment, and therefore preparation can sometimes mean that we get better, when we prepare, we get better results at the other end of it. A question, I've just been asked it today again, but a question that comes up quite often is how deep should I go when I'm microneedling? And I address this question because it's something I want you to think about strategically, not just as a textbook answer. I was training one of my own therapists today on microneedling, and it's a question, how deep should I go? And I want to just say that it's not textbook, and I want to help you to understand why. You have to define your treatment objectives. What is your target when you're microneedling? Which hopefully in the next slide I'm going to help you understand a little bit more. But we've got to be familiar with the depths of the epidermis and the dermis. But I want you to just think again bigger with microneedling. Just don't think static depths and limitations, but I want you to think of the outcomes and the incredible benefits you can get by not always going deeper. Every skin is unique, and each time you treat, this may be different. So depending on what your target is, will depend on what depth you're going to treat at. And it's not that deeper doesn't always mean better. Deeper isn't always the goal, and I hope you can see that through this presentation. There is certainly a time to go deeper, but there also is incredible benefits by doing epidermal needling as well. So before we think of depth, a little analogy that I like to give people is to think of what kind of fabric you're working on. Think of skin as a fabric. I want you to take the time before you do a treatment to assess the skin. How does the skin feel? So we know when we put our hands on people's skin, we could have a skin who's like mine, very fine and delicate, easy flushed, easy blushed, quite reactive. You can get skin that's very turgor, it's very thick and leathery and waxy. You know that if you've worked in skin long enough, you'll feel the difference between skin. You could get skin who's very scarred and, quite ruddy and quite thickened. So you really have to think, what type of fabric am I working on? And I allude to the satin and the leather because skin is really like that. You could have somebody as delicate as satin, and you could have a skin that is as thick and hardy as leather. And there's a very different way, which when you analogize that makes sense should you want to adapt your treatment to that skin. You also want to think about how has a skin previously been treated? Have they done a lot of invasive treatments? Have they been using a lot of ingredients to break down the skin barrier? What previous things have been done to the skin? And that will help you to assess the skin that you're working on right now and how you maybe treat initially and how you will go on with that client journey as the skin progresses as well. So understanding depth matters. If you know by now, I like to use analogies to help you see that. But when I think of epidermal and dermal needling, I like to think of seeds. So there's a time when you want to plant a seed and there's a time when you want to dig something a little deeper. And so we've got to think of, again, the depths of the skin. If you think we're just superficially planting seeds, you don't always have to dig 6 foot deep to plant a seed. And I want you just to keep that in the back of your mind as you treat clients for certain clinical outcomes. So to help you understand this a little bit further, again, think, what is my target when I'm microneedling? I understand that it will be clients that come and you with multiple skin concerns. You could have somebody, of course, we're all concerned with anti-aging, but we might have somebody who has a little bit of excess keratinization in the skin. They maybe have some epidermal pigment problems. There could be a multiple factors of reasons why somebody is coming to you or that you're suggesting that they have microneedling. And so again, when it comes to depth, this is not static. And there's a reason why we may want to stay in the epidermis, and there's a reason why we might want to be working in the dermis. And I'm just going to give you this quick thought process just to help you understand this a little bit further. I know this is being recorded, so it may be something that you want to go back to. So epidermal needling, your clinical endpoint is erythema with no blood. So that means that when we're needling, we're bringing up the blood flow to the skin. You can see that lovely erythematic response, but we're not necessarily drawing blood. You might get a very, very, very minimal amount of petechiae just coming to the surface, and then you withdraw down. And I believe this one is best for congested skins. So again, we have skins that just have a lot of texture to them, with a lot of epidermal congestion. And the reason this works is because we release the keratinocyte growth factor, which helps to reduce congestion by stimulating desquamation. Some of these things we're overlooking in skin, and I believe they can be powerful tools to really understanding our clients and getting those results. So a great treatment for those clients who are very easily congested and very rough in texture as well. For acne reduction, again, feel free to ask me questions in this. We're not going to needle necessarily very inflamed acne. It hasn't been pre-treated, but we can absolutely treat acne with microneedling. I believe that for sure. It helps with the oxygenation of the skin, and we know when the skin is rich in oxygen, it really helps the skin to control the amount of breakouts. Very powerful for grade 1 and 2 acne. So again, there is limitations to how we maybe treat certain types of acne, but in my clinic particularly, we've had fantastic results with grade 1 and 2, and particularly when the skin has been pre-treated as well. In terms of pigmentation, if somebody comes to you and their main concern is pigmentation, we know that when we epidermal needle, we're downregulating the MC1R gene and also releasing the TGF-B3, which is your melanocyte or your anti-inflammatory growth factors, and also your melanin growth factors as well. So again, if we're really trying to reduce pigmentation and control the melanocyte, then we don't want to be in the dermis when we're treating that skin, because we've actually passed our target as well. And again, the opposite then of dermal needling, so our clinical endpoint will be erythema, but we will want pinpoint bleeding. And that is, we know when we've got blood, we're into the dermal, we're past the dermal epidermal junction. And this is going to be best for any type of scarring. So scarring, significant dilated pores, wrinkles, stretch marks. So anything that has caused the skin to break down, then we want to be in the dermis. And again, particularly, we obviously have your TGF-B1 and we have your fibroblast growth factor as well. So we're trying to chase that collagen and elastin. With rosacea as well, this is where we have these other overlooked growth factors, your vascular endothelial growth factor and your platelet-derived growth factor, which are fantastic for reducing the inflammatory markers in rosacea skins. And also, because we're increasing collagen and elastin and strengthening the epidermis, again, we're Irish in this country, we get a lot of rosacea. And again, once under control, we see a significant management improvement in our rosacea clients. And the one thing that we don't want is any of our TGB1 and B2 and our heat shock protein, because that is going to create more scar fibrotic type collagen, which we don't want. And again, when a treatment is performed well, that's never going to be an issue for us, thankfully. Again, I am passionate about all the benefits that microneedling can bring. We always chase the collagen and elastin, which is great, but I want to think of cells and systems that we have an impact on whilst we needle that skin. So increased circulation. So one of the things, especially as therapists, or some of the things that we overlook, we know that increased circulation is going to deliver oxygen and nutrients to the skin. So feeding that skin is really, really important for the cell health and just natural renewal and rejuvenation. We know that as part of the microcirculation, we have our lymphatic system, which we're going to help with aiding the removal of toxins and waste product from the skin, again, helping with healing, but also just general improvement in the skin health and appearance of the skin. We're obviously opening the skin, so we're getting an increase of oxygen in the skin, which helps eliminate the aerobic acne bacteria, which we just spoke about in the last slide. And definitely one thing in my practice that we see is that we get a significant reduction in active acne lesions in clients who've been maybe suffering with problematic breakouts in particular areas. We see such a reduction in that from microneedling. And also we can enhance absorption of skincare products. Obviously it's not, microneedling itself isn't just solely for that, but we can definitely help with penetration of active ingredients, which then can take our results on to further specific skin concerns or desired treatment outcomes that we're trying to work alongside as well. Some other things to think about. So you can see the collective benefits of microneedling, and certainly for me, they are just endless. But when we think, going back to the benefits of microneedling, we talk about the acne scarring, which is very prevalent, obviously, if somebody's had a significant amount of acne. We also have the post-inflammatory erythema, and we have the problem of post-inflammatory hyperpigmentation. So it's not just the scarring that we have to deal with. It's for some people, and particularly in lighter skin tones, it's the PIE that's the real problem, particularly in Irish and pale skins. And then obviously in darker skin tones, it's the post-inflammatory hyperpigmentation. Of course, a lot of the time they coexist with each other. So we're not just treating the scarring, we're generally treating scarring with the post-inflammatory erythema and also post-inflammatory hyperpigmentation. And I suppose collectively, microneedling is working on all three levels of that at one time. So we can really see a reduction in not just one, but all three of these through our microneedling treatment. So again, it's not just the collagen elastin we're seeing a reduction in all of those three parts of particularly those that have had acne or scarring issues in their skin. So my personal ethics on needling for success. I've alluded to this, but a quality device is a must. And I often say this, you cannot afford not to. You know, when you look at the disparity of price in our industry, it sometimes seems a lot at the time, but I can assure you, for somebody who's used previous devices, a quality device is something that you cannot afford to have, because the outcomes that you will get will pay dividends in your business. Personally, for me, I don't believe it's a new client policy. I never offer a new client who's just walked into my clinic today to have microneedling as a first treatment. And that's not because it's unsafe necessarily as a treatment, but I want to give my clients the best outcomes. And so I always start at the point of consultation. Go back to those things we think about, all the cells and systems. We want to make sure that they're optimally working correctly and as healthy as possible, so that when we introduce microneedling to that skin, we get such a measured response to the microneedling. We have a healthier stem cell, which is going to replicate more healthy cells. And the opposite is true. Unhealthy stem cells replicate unhealthy stem cells. So we don't want that. So we really want to try and prep the skin and discuss that with your client from day one. I want to start with a consultation. So we'll really take the time to thoroughly assess the skin to really see where our clients are at. We want to see the main concerns they have, and then we want to map out that client journey for them. And again, preparation for me is absolutely key for microneedling and all treatments, to be honest. But I would say a minimum of 4 to 6 weeks, which is really just one skin cell cycle. When you think about it, it's not a long time. And some of the key things that I believe is really, really important in cell health is good quality essential fatty acids, both topically, ideally, and orally if needed in supplementation. Quality hydration. So we overlook things like water, but a healthy skin is well hydrated, and that aids natural desquamation. So a hydrated skin will have less problems after microneedling than somebody who's dehydrated. And like we said, DNA repair ingredients, so vitamin A, vitamin C, vitamin B, there's multiple ingredients we know that have the impact on the quality of the skin prior to our treatments. We also want to set realistic expectations with our clients. So you've heard all the benefits that I've talked about with microneedling. There is incredible amounts of them, but we want to set realistic expectations. Microneedling is not a facelift. So we have great benefits, but we do have limitations. And that's, I mean, it's a positive that we want to give our clients realistic expectations for their skin concerns. Because when we do, they'll really value and trust you as a skin therapist or medic or whatever profession you're in. For me personally, I always prioritise education over industry trends and fads. Our industry is one of the fastest growing industries globally. In fact, I think it could be the fastest growing industry at this time. And again, when I came into the industry 8 years ago, I come into it and my business name is the Skin Health Clinic to improve health of skin because I could see a degradation in the health of people's skin. And unfortunately, for all the options that we have in our industry and products, skins sometimes, I believe, are getting worse rather than better. So always prioritise your education over just following industry trends and quick fads or fixes. Again, I believe if you treat with integrity, the money will come to your business by your reputation and the results that you can give your clients. And the little bit of wait and preparation will pay dividends for you and for your clients as well. So it goes without saying, in microneedling, we have the option to do combination treatments, something that again has maybe been quite trendy in our industry for sure. So what we alluded to just a few slides back was the added benefit of absorption of topical ingredients to be used during your microneedling treatment. And absolutely, you can do that for sure. And it's something that we do in my clinic as well with our microneedling, not for every patient, but for the option we do give that. So we can certainly add topical ingredients or mesotherapy, sometimes in your country, what that might be known as. But it does facilitate the penetration of those ingredients. Obviously, we've created tiny punctures in the skin, and therefore we are definitely going to get more absorption of ingredients through that skin. There is definitely a positive benefit which can accelerate wound healing and reduce the downtime, all things that we want for our clients. But just one thing that I always say, go back to the education, is it safe and approved to be injected? Because technically when we have a needle skin, we're now applying something beyond the surface of the skin. So it needs to be safe and approved to be an injectable product and to be used alongside microneedling. And you just want to think of the risks and benefits of that. I always say, like I say, I'm passionate about skin, but it is an organ. And it has an immune system, and what it doesn't like, it will tell you. So side effects are absolutely possible, and we've got to be careful that, again, what we're using is safe, because a lot of the problems, I believe, and the risks that with microneedling are not to do with the treatment themselves, but perhaps what we're doing alongside our microneedling or what your clients may be using post-microneedling as well. But don't forget that microneedling alone is a fantastic treatment. We don't always need to add to it. What it does, we've just spoke about with all of these things. So don't underestimate the power of the needle itself. Another thing that has become very popular in the industry is a combined option with radiofrequency. So RF microneedling, radiofrequency microneedling. Again, there's a lot of different terminologies for that. But really, they are classified together, but they are two separate modalities. So obviously we have the needling aspect, and then we have the radiofrequency delivered through pins. So really, even though it's classified as one treatment, I believe they're still two separate modalities. The way we microneedling with Exceed is not, you're never going to get the same clinical outcome as you are through an RF static microneedling device. Certainly each modality has its own benefits, but I do want to just allude to the fact that with microneedling, we have no thermal injury in the skin. We're not introducing heat. And of course, we want to create a wound healing environment and create some inflammation. But we've just got to be careful, particularly in our industry, that we don't overdo it when it comes to combined treatments, because there certainly is more risks involved. And I truly believe that sometimes we're always trying to add to things and actually could be taking away some of the positive results that are possible with our treatments. And the thing also is that some of these treatments might be good for certain age categories, but personally for me, RF microneedling is not something I would encourage on a younger skin with already good quality collagen and elastin. So again, just important for you to understand what outcome you're looking to achieve, the age and stage of your client, the quality of the skin. There's a lot of things to take into consideration. But like I said, microneedling by itself is still a very incredible technology when used correctly. So, small device, but huge impact. I hope you can see from those images, and that's just a snippet of results that can be achieved with microneedling. But we have such a small device that fits in our hand, but we have a huge impact that we can get with this device. I believe microneedling definitely serves as a bridge between all the scientific advancements and the beauty goals that our clients have in our clinics. The impact it has is undeniable. It offers comprehensive rejuvenation through the keratinocyte and fibroblast stimulation. So again, epidermal and dermal, we have options for both, and we can get a significant improvement in all levels of skin with it. We have huge expectations placed in us. We have clients following social media and all the things that they want to do and all the possibilities of treatments. But I believe with microneedling in our hands, we have a significant tool that can give and deliver the results that our client wants. So let's not underestimate the transformation potential of microneedling. It is a small device, but it is incredible to improve into a healthy, vibrant skin for our clients. And like I said at the start, when skin is at its best, it will look its best. And microneedling is one of the best tools that we have to have a healthier skin that looks its best and also feels its best. So as this part comes to a close in terms of the practicalities, I want you to remember that this small device isn't a magic wand, but it is a powerful tool for skincare transformation, both for your clients' results and to transform your business practice and the results that you can get and to develop your business with a successful emphasis on microneedling. Part 2, we're going to look at microneedling versus skincare, and do you really need both? So I am very aware that we have probably a mixed audience and live, and we'll watch later, in terms of some people who thoroughly believe in skincare and some people who think, well, it's just topical. Surely it doesn't make that much of a difference to the skin. So we want to look at, do we really need the both in our practices? So why would you consider skincare? Well, skincare is definitely an essential companion to device-based treatments. It's absolutely essential that our clients are prepping the skin before they come to us for any device-based treatment. I believe the industry trends demands that we have something to bring to our clients. People are actively using skincare, and I believe it's something that our clients want as well. Clinic owners offering combined device and skincare protocols report higher client satisfaction and retention. Again, I am somebody who is a therapist, but I own a clinic, and I can tell you that having skincare alongside the treatment you offer has definitely higher satisfaction rates for your clients, greater results, and greater client retention. So if you're not aware, AmiMed have brought out some fantastic products to use alongside your microneedling treatments. Again, if you don't have skincare currently, they're for you. If you do have skincare, they're also to be used alongside. And I hope you can see, just as we highlight some of these key products, how you can bring them alongside your microneedling treatments. So again, before we microneedle, we've got to prep the skin, we've got to cleanse it. And we have our product called Bare Skin Face Cleanser. A fantastic non-drying cleanser, soap-free, sulfate-free. So again, really good to prep the skin prior to our microneedling. It helps to restore the skin's balance. It won't dry. It's lovely and calming, and can be used pre-microneedling treatment. And it can also be used on the evening post, which is really, really important for our clients. If they need to cleanse the next day, that is very safe for them to be able to use a product that is safe to use post-microneedling. So again, one of the key ingredients you're going to hear throughout with the AmiMed products is the fantastic ingredient called Sandalore. So research has shown us that Sandalore has a significant calming effect on the skin, reduces irritation and promotes skin comfort. It also has bisabol in it, which we've heard quite a lot of over the years, but its ingredient sometimes is overlooked. But again, really good at controlling inflammation and encouraging skin healing and regeneration. Very good for beneficial for all of our sensitive and irritated skins as well. So this cleanser is not something that is just for one or the other. All skins, I believe, have the potential to be sensitive and reactive. So very, very safe to use it. Aloe vera, also great hydrating ingredient in the product. So again, we're not going to get any of the drying effects that sometimes people use with soap-based cleansers. One of my favorite, the Cell Activator Serum. So again, we know what a serum is. We want to feed and nourish the skin with specific ingredients for cell regeneration and renewal. So we have our Cell Activator Serum, which is a powerful serum to be used at home and post microneedling treatments. I always explain to people that your serums is the food that your skin needs to accelerate those ingredients. So again, it's going to help control the inflammatory process, but it's going to promote cell regeneration, all of the things that we want our skin to do, which is to recover and to thrive after treatment. So again, can be used post microneedling treatment and obviously then continued on with our client journey. They can use that product on morning and evening as part of their normal skincare routine. And we have our Sandalore in there. We have our Leontopodium alpinum, which is bladderwrack for any of these, our Edelweiss, sorry. So again, a significant antioxidant for skin, controls the inflammation in the skin. It's an antioxidant as well, so it's great for cell protection and regeneration. So key ingredients again in our Cell Activator Serum is going to be our Sandalore. So again, reducing inflammation, it's antibacterial, antimicrobial, which is really important for our acne clients. We have some salicylic acid, so enhancing our natural desquamation of the skin. Again, if we do have congestion, it's going to go down and clear out that debris in the skin. Again, we have our Edelweiss and regeneration, anti-inflammatory, antioxidant. So again, all those things. And then we have our bladderwrack down here as well. A great ingredient as well for antioxidant, inflammation, cell protection, and also for anti-aging as well. So it's a very key ingredient, and studies have been shown to reduce wrinkles. With that, I was actually reading something about that very recently. So yeah, really good ingredient deck here as well for us. Again, another favorite, skin repair moisturizer. We obviously know that the health and hydration of a skin will come from, well, the hydration dictates the health of the skin. So we definitely want something that's really going to help repair any dryness that our clients might experience after some microneedling and keep that skin quality in between treatments. So again, it's a very carefully formulated ingredient, which we'll look at the ingredients just in a little second. For me personally, it's a very light feeling moisturizer, but gives a lot of hydration. So I would say it's very unique in the sense that all skin types can benefit from this moisturizer. Again, post-needling, morning and evening routine, something that probably needs to be felt to be experienced really, really well, but it's definitely light, but has a super repairing ingredient in it and really does feel incredible on the skin as well. So key ingredients, I'm sure a lot of you will be familiar with these. Some of my favorites in here, so hyaluronic acid, safflower and jojoba. So at this point, we want to look at the moisturization of the skin. So again, jojoba is close to our natural sebum and it's our safflower, and then hyaluronic acid, the water phase of hydration as well. Triglycerides, phosphatidylcholine, again, really good for the inflammation and protection of the skin. It's on our natural cell membranes. Lactic acid, again, naturally helps with hydration, but has a mild exfoliation property in there as well. So again, just natural desquamation. We've obviously got our vitamin E and bladderwrack in there again, and our phytic acid. And of course, we have our Sandalore and our Edelweiss, which is our Leontopodium alpinum, such a name and long. But again, really, these key ingredients are for managing any irritation, inflammation, promoting faster recovery, and also promoting collagen production. Those three things are really, really important for any skin, but particularly after microneedling. And another favorite, I have to say, probably, I think if people have tried these, it'll be their favorite, but the face relief mask. So a beautiful biocellulose mask, a beautiful feel to this mask. We know after we microneedle, we want to control the inflammatory markers on the skin. We want to leave our client's skin feeling as comfortable as possible before they leave us. So this is going to soothe the skin post microneedling. It's not going to irritate the skin. Again, no artificial fragrances or scents in the products is going to annoy the skin after microneedling. Adding some of that immediate relief for hydration, which is sometimes something that people notice a little bit of dryness. But again, definitely feel it to experience it. But definitely can be used directly after your microneedling treatment. And again, it does come in a box of 5, so it can be purchased for your clients to take home and to have for that relief and hydration post microneedling. Again, some key benefits just to highlight in the face release mask: hyaluronic acid, your betaine, your vitamin B5, allantoin, and we have our olive leaf extract. So again, a great combination of ingredients to hydrate, to reduce the inflammation, to help control any irritation, and again, cell regeneration. So we have a really good deck of ingredients in there to really help amplify the results and control any of the, or mitigate any of the downsides of microneedling, that little bit of discomfort, but to leave our clients and patients comfortable before they leave us as well. So again, all of these products, which you'll see in the slide, and you can review back to them if you wish to go back to the presentation. But allantoin has definitely been well documented with its studies for cell protection and enhancing the skin's natural repair processes. So again, going back to that epidermal barrier health, we've got the ingredients in here to really improve that, as does D-panthenol, and your olive leaf extract has been shown to possess significant antioxidant properties. It's a really good ingredient in there to prevent damage and also to reduce inflammation. So again, the ingredients have been chosen with great intent to really help enhance the results and, I say, control some of those or mitigate some of those minor sensitations that our clients might experience after a microneedling treatment. So complementing Exceed with skincare. Microneedling, for me, the results are definitely shaped from what comes before and what happens after. So therefore, healthy skin preparation is key, as is post-treatment care. So again, we want to make sure that our clients are prepping their skin well and they're going home to use ingredients that are really caring for the skin. I always say not all skincare is care, but we want to make sure that our clients are going home with ingredients that are going to help promote the results that we want. And I often say this, for any small issues that do ever happen with microneedling, truthfully, I believe it's probably most likely the clients, what they're applying post microneedling, that causes any of the reactions we see. So having ingredients like this that the client can go home with and to use after their treatment mitigates a lot of those risks and side effects that, to be honest, I don't really see, thankfully. But having those ingredients to prepare the skin and to treat the skin post microneedling is going to get us the best results. So pre-treatment, obviously, just to note on that, we want to strengthen the skin barrier, we want to improve the hydration and nutrient absorption. And post-treatment care, we want to reduce the inflammation and redness where possible. We want to enhance the tissue repair and regeneration like we've spoke about, but this also ensures that we get the best long-term results for our clients. So why clinics will want this combination? Clinical benefits, like we've said, faster healing time has happier clients. I think, I have microneedled for the best part of 7 years. And like I said at the start of the presentation, our clients want the results with as little downtime and trauma as possible. And as, people of skin professional, we should understand that we have both a needling device that certainly mitigates a lot of the issues, and we have the power in our skincare to really control and mitigate a lot of the side effects that we would have previously seen years ago. I always say when we know better, we do better, and certainly this combination that Amy might have brought up is fantastic. Revenue benefits obviously make sense. It creates opportunity to sell skincare alongside your treatments. And having a dual approach means that it's encouraging repeat visits for both the microneedling treatments, but also clients that love these products will be repeat buyers of them. And it's going to help your business long term in terms of the investment from your client and that length of client journey as well. And you know, it's professionalism and trust. I believe that when you understand skin and you're doing some of these advanced treatments, you will understand the benefits of adding skincare alongside these treatments. It's a comprehensive approach to care to your clients. And when you explain that to them, your professionalism and trust is elevated. And I know you're going to talk about this just a little bit later on, but we have the Exceed Complete Care Box, which Cash is going to talk about and explain a little more about. But it's going to make sense because all of this together, this combination approach that I've just spoke about, is all part of our Exceed Complete Care system.
Exactly. Thank you so much, Victoria, for starting this for me. So this is to inform you that as company, we just launched the Exceed Complete Care Kit. And that is a kit which contains pretty much everything which a clinician needs to perform microneedling treatment. So it will have a pack of cartridges. It will have a pack of safety sleeve that you need to protect your handpiece. It will have a pack of sterile gliding gel, so you have something to perform your treatment with. And you have one piece of each skincare product that Victoria has mentioned with the beautiful cosmetic bag for your customer. So the idea here is that you can gift this to your customer so they can try the cosmetic products at home and they can have the optimal results of the treatment. And you will also find a set of printed material in English. So you will find a guidebook that will guide you throughout the treatment. If that's your first microneedling treatment, you will have a patient leaflet that you can present to your patient. You will have a patient passport. So a little bit of tools that will help you just perform the treatment in the best way possible. So thank you so much, Victoria, for sharing that amazing knowledge you have with all of us.